All right, thanks, Brecken. Every night at 6 p.m., we are taking you deeper into the impact of the coronavirus.
And tonight we are joined by Dr. Ali Hassoun, an infectious disease specialist with Huntsville Hospital. Thank you so much for being with us this evening.
Thank you, Naja.
Dr. Hassoun, as the temperatures get warmer, many families are excited to head back to area swimming pools, but is it safe?
That's really a great question. I think at the moment, any gathering with a close contact, I don't think it's a safe or a good idea. As we said before, our main concern with this bigger gathering is that there will be a higher chance of exposure, higher chance of transmission, and that being increasing in cases. So I really don't think it's yet a good idea.
There are reports that the chlorine in the pool and the chemicals inactivate the virus. Is that true?
So that's true. Chlorine would kill the virus. But as you know, the main method of transmission is usually by droplet and respiratory transmission, meaning through cough and aerosols. So the chlorine will help the water, but that way of transmission is not the main way anyway.
And Dr. Hassoun, keeping that in mind, what about saltwater pools? You said chlorine can kill the virus, but do saltwater pools, are they effective in that as well?
We're not aware if salt water as such would kill it. There's been some data talking about if you, for example, gurgle in salt water, there might be some effect, but we're not sure 100% of that.
So, of course, there needs to be social distancing guidelines around the pool. That's where you think the big problem would be. Do you think this would apply to just adults or kids as well?
So it will be very hard to get the kids follow social distancing because you'll see adults is not following it regularly. What I would say for children, it will be a good idea to have the family together to go out and gather rather than get the kids get exposed to others. And the same goes for the adults. So if you want to go out, you want to go to the park, walk, do other activities, do it all together as a close family, those who's in close contact all the way at home, but it shouldn't be done more than that.
And it is now summer for many families, and some camps are reopening. What is your best advice for parents, or what message should they be relaying to their children as many kids do head to camp this summer?
Yeah, so I think if the camp is necessary, then they're going to need to follow pretty strict guideline of reducing occupancy, try to follow as much as possible the exposure, social distance if possible, screening, for example, if any of the kids or the youth develop symptoms or they had exposure, to be on the look for that. So they need to have protocols set to reduce the chances of an outbreak or infection.
And we're hearing a lot about a possible surge of new cases in the fall. Some families also in the situation where if they have to return to work are going to have to send their kids back to the classroom. How concerned are you about that?
So again, I think if the school get to be reopened, there's going to be a protocol set in place. The CDC already published guidelines to the schools about what to do if they reopen, about social distancing, hand hygiene, ventilation of the school, aeration, sport activity, what to do with it. So they need from now to have some set protocol, but as well, probably if there are certain classes can be done through internet, e-learning, it might be a good idea to think about mixing things rather than do it the whole way face-to-face. They're going to need to set a protocol to be able to reopen. Otherwise, if there's one case happen in a school, unfortunately, this is going to end up shut the school down.
Yeah, and protocols are all well and good. You heard the story a minute ago about the Austin High School teenager who found out after his graduation ceremony that he was positive for the virus. Apparently, the family knew of the potential exposure. We're waiting on test results, but went out anyway. So is that a big fear of reopening and people just not following these guidelines?
So absolutely. I mean, we know our community and we put big faith in our community to follow the guideline, but also be responsible. This might be a minority, and I think it's always we're going to be continuing be persistent about education, give more information, whether student, teachers, employee, and I think with time, definitely we'll be able to reduce these issues that's coming up. Are we going to avoid it 100%? I don't think so.
And so in your opinion, should people be held responsible for heading out into public if they're aware of a possible infection?
Yeah, that will be very tough to judge because there's a lot of circumstances come around that. So you need to know the full circumstances, issues with it, what that student been told, how things happen. Can we, get each one of them held responsible? I can tell you in a previous type of infection, when some people, for example, expose certain people to infection, there is some fines can happen. But I think education and understanding situation, prevention might be the best thing to do.
Earlier this week, Alabama saw its 2 biggest daily increases of new cases since the pandemic started. Yesterday, the daily increase dipped back down, thankfully. But what do you attribute that spike to? Is this a sign of things to come?
I think it's 2 main factors. One, we're probably doing more testing, but I don't think testing alone is a good explanation. I think people, and I've seen it and you've seen it, people is not keeping up and following the guideline of social distancing and avoid, exposure, unfortunately. So if they keep doing that, I think we're going to see more cases, definitely. They need to be careful.
And just this week, Huntsville Hospital's CEO said that North Alabama's hotspot, which is Marshall County, does not currently have any inpatients despite having by far the most cases in North Alabama. What is the takeaway from those statistics?
I think the good news about Marshall County, there's probably a lot of effort to reduce transmission. I think it's a little bit early to judge on that, but I think there is some signs it's working in a way. So what we usually see as we make an effort, we reduce transmission and reduce infection. Some of these patients who've been already there for already infected, we're going to see them in the hospital, and then as they get discharged, hopefully the rates will go down more. I think it's a little bit early to judge.
And finally, Dr. Hassoun, you're on the front lines. Give us the bottom line on a vaccine.
Yeah, so there's a lot of news about we might be able to get the vaccine earlier, but I must say, to be optimistic, this might gonna be, it's very optimistic, might gonna be around October, November. But that will be really, really very optimistic.
But you think sometime this year?
It's possible because the trials that's ongoing, it's been pushed very hard to try to get a vaccine. Of course, this is going to all depend on safety and efficacy of these vaccines.
Sure.
And that's very imperative. Yeah.
Dr. Ali Hassoun, we always appreciate your insights. Thanks for joining us.
Sure. Thank you.